a breast cancer breakthrough, and a new development could hold the key to fighting this disease. Jackie Hyland is here with this new medical news. Jackie?
Jim, 1.9 million women around the world will be diagnosed with breast cancer this year. It will kill 400,000 women. But now, thanks to some new findings, doctors may finally have some information to help fight the disease faster and earlier.
This is a tremendous breakthrough in our understanding of breast cancer, and it is so relevant to women because 1 in 9 women will get breast cancer, so we are all touched by this.
Dr. Keri Peterson, an internist working in Midtown Manhattan, calls the latest breast cancer findings historic. They come from Canadian researchers who documented the genetic transformation of a breast tumor and found all the mutations or the spelling mistakes that caused the cancer to spread.
This is unprecedented information for how cancer cells may develop and progress. And with this information, we could hopefully either detect the cancer earlier or treat it much more effectively.
The landmark study was published today in the science journal Nature. For the study, scientists examined a breast tumor from a patient with estrogen-positive cancer. It's a type that causes about 15% of all breast tumors. They compared samples from her original biopsy and from a tumor that spread 9 years later. In all, scientists say they found 32 mutations, 5 of which had never been linked to cancer before.
This gives us a starting point to work with, because now what scientists will do is look at these mutations and try to target therapy, try to prevent the mutations or stop them in their path.
The discovery is also a wonderful example of how investment in research is helping pave the way toward better outcomes for cancer patients.
We, as women, take part in so many efforts to try to raise money, to try to raise awareness, and to create contributions financially to these foundations. And often we wonder, is it working? Is it helpful? Is it creating progress? And we can confidently say that it is.
Now remember, this is not a cure for breast cancer. This information represents how it develops so it can be treated faster and more effectively. And it certainly gives some fresh hope to millions of women and their families who are diagnosed with breast cancer every year.